Next thing is like you should know about CPB. We have already discussed in our cardiovascular section what a CPB is, which is a cardiopulmonary bypass. Here you should know this patient is being subjected to techniques like heart-lung machine pump or heart-lung pump, where what happens is the activity of the heart and lungs are being taken over by this machine. So whenever the surgery is going to be done, the patient is under the care and control of those devices. So please select the codes accordingly, because under this anesthesia chapter, we have so many codes with CPB and without CPB. When CPB is not instituted, you should not report the code with CPB. It should be technically without a cardiopulmonary bypass. Next thing is coming to global surgical package. My question is the anesthesiologist bound by the global surgical billing rules? So we all know the global days like 0, 10 and the post-operative days of 90 for major surgeries and 10 days post-op for minor surgeries. So my question is the anesthesiologist bound by this global surgical billing? It's a no. It's a big no, because anesthesiologists do not fall within the scope of global surgical billing, because this is exclusively for the surgeons. Because the patient's care will have to be taken care by the surgeon even after the surgery. It is a post-operative management by the surgeon. Whereas when an anesthesiologist is taking care for the post-operative pain management, then you can very well report this particular service.